Good afternoon, everyone. My name is Kira Sanders. Today I will present to you my organization Helping Hands Trauma Treatment and Resource Center. Helping Hands is a treatment center that targets individuals between the age of 13 to 65 who are living in the West Baltimore area. These individuals have either has a history of trauma, has recently experienced trauma, or has been formally diagnosed with post-traumatic stress disorder by a clinician. Helping Hands' reason for servicing this community is because of the increase in community violence but the lack of mental health treatment and diagnoses. To begin, post-traumatic stress disorder develops after someone's safety is threatened and they feel hopeless. An individual can also develop PTSD by hearing a traumatic experience of another individual. War veterans are often diagnosed with PTSD after they have been on the battleground. However, according to a study conducted by Georgetown University scholars, African Americans living in high crime and impoverished neighborhoods who have possibly been victims of community violence are just as likely to suffer from PTSD. According to the United HHS Office of Minority Health, 9.1% of African Americans will have a lifetime prevalence of post-traumatic stress disorder. 20% of adult African Americans have reported serious psychological distress according to data from the National Survey of American Life. Do you believe that racism is considered a form of trauma? PTSD has been linked to race-based trauma amongst African Americans. There are different types of race-based trauma such as racial harassment, discrimination, witnessing ethnoviolence, discrimination of another person, historical or personal memory of racism, institutional racism, microaggressions, constant threat of racial discrimination. Race-based trauma may not happen directly. It may be what you hear or see in the media or in person. African Americans are subject to these different types of racism every day. The common threat is perceived to be an influence in PTSD. Some other causes of post-traumatic stress disorder are rape, kidnap, sexual abuse, physical abuse, child neglect, car or plane crash, and the sudden death of a loved one. The mission of Helping Hands is to provide extensive treatment services to Baltimore City residents between the ages of 13-65 living in high-crime/impoverished neighborhoods. Our goal is to provide efficient mental health treatment and referrals to individuals in need in that community. Eventually, Helping Hands would like to decrease the crime rate and help to improve community effectiveness. Helping Hands provides a variety of services: individual psychotherapy, behavioral and cognitive therapy, group and family counseling, behavioral and cognitive behavioral therapy, eye movement desensitization and reprocessing, medication, which is seen as one of the most effective treatment options. This would include medications such as anxiolytic, antidepressants, and adrenergic agents. 24-hour telemental health for clients who may be seeking immediate help from therapist. Community referrals and outpatient referrals for housing, substance abuse, education, and employment. Transportation will include MTA tokens that are provided through grant services. Food pantry to deter hunger. Helping Hands will employ Maryland state licensed clinicians with a psychiatry or psychology background, clinical social workers, professional counselors, BSW social workers who will act as advocates or case managers. Studies of racial discrimination and race-related stress show that people often experience psychological distress, but trauma was not considered. Studies of trauma and PTSD consistently have shown that people of color have elevated levels as veterans and civilians, yet racism is rarely included as a factor. The notion that racism is a stressor that can harm or injure its targets is not recognized in psychological or psychiatric assessment or diagnostic systems. The law requires that there be a direct link from the racial encounter to emotional harm, thus racism needed to be micro, such that the event could be shown to affect a person's mental health. According to the race-based traumatic stress injury model was created by Robert T. Carter. Encounters with racism must be experienced as emotionally painful, sudden, and uncontrollable. The reactions are expressed as intrusion, avoidance, and arousal, and with symptom clusters of anxiety, anger, rage, depression, low self-esteem, shame, and guilt. Some symptoms of a PTSD may include separation anxiety, losing previously acquired skills, problems sleeping. The child may repeat aspects of trauma through play. They might develop new phobias, may have unexplained aches and pains, and may tend to be aggressive and irritable. Adults who experience PTSD may re-experience the traumatic event. This may include upsetting memories, flashbacks, and nightmares, as well as feelings of distress or intense physical reactions when reminded of the event. Avoiding reminders of the trauma. You may try to avoid activities, places, or thoughts that remind you of the trauma, or be unable to remember important aspects of the event. You may feel detached from others and emotionally numb, or lose interest in activities in life in general, sensing only a limited future for yourself. Increased anxiety and emotional arousal. These symptoms include trouble sleeping, irritability or outbursts of anger, difficulty concentrating, feeling jumpy and easily startled, and hypervigilance. Individual is constantly on red alert. The process of the program will include weekly intakes that will occur 7 days a week and will include a 1-hour orientation. Mental health assessment will include a 1-hour counseling session with mental health therapist. Strive to develop a treatment plan for each client in collaboration with the client, her or his support system, respective treating providers, and other key stakeholders. Resources and referrals are prepared that aims towards barrier removal and encourages that client to complete therapy sessions. Case managers are responsible for evaluating the client, assessing the client and their environment, creating a plan in collaboration with clinical therapist and psychiatrist, implementing a plan, and monitoring the client's progress. Case managers also address the total individual, inclusive of medical, psychosocial, behavioral, and spiritual needs. Collaborate efforts that focus upon moving the individual to self-care whenever possible. Increase involvement of the individual and caregiver in the decision-making process. Minimize fragmentation of care within the healthcare delivery system. Using evidence-based guidelines, they focus on the transitions of care, which includes a complete transfer to the next care setting provider that is effective, safe, timely, and complete. Case managers are required notice or consent to the client regarding the purpose of the case management services and related information about the program. Provide notice of the availability of a complaint process and the method by which to access it. Complete a comprehensive, culturally and linguistically appropriate assessment of each consumer. Identify problems and barriers that would help create interventions. Provide referrals to agencies and community organizations to eliminate client barriers. Strive to develop a treatment plan for each client in collaboration with the client, her or his support system, treating providers, and other key stakeholders. Support the physician or practitioner and consumer relationship and plan of care. When addressing post-traumatic stress disorder, case managers must first address the client's first need. Because substance abuse is common for individuals who have experienced trauma, professionals must evaluate the client's use of drugs. The World Health Organization created protocols and guidelines for addressing the mental health consequences of PTSD, acute stress, and bereavement in 2013. They allow primary health care workers to offer basic psychosocial support to refugees as well as people exposed to trauma or loss in other situations. The types of support offered included psychological first aid, stress management, and helping affected people to identify and strengthen positive coping methods and social supports. Referral for advanced treatment such as CBT or EMDR should also be considered. However, African American are still least likely to be properly diagnosed and treated for the same disorder. To increase the effectiveness of service, Helping Hands has partnered with Baltimore City Public School, Youth Opportunities Program, Johns Hopkins Bloomberg School of Public Health, Baltimore Behavioral Health, Mental Health Association of Maryland, National Center for Victims of Crime, Center for Urban Design and Mental Health. Various types of insurances will be accepted for clinical treatments such as Medicaid, Medicare, private insurance. Grant funding from Johns Hopkins Hospital and Baltimore City is provided. Agency is located 1111 North Avenue, Baltimore, Maryland 21216. Contact information 410-639-7898. Program Director, Kira Sanders. Questions?